So this episode, hola, hola, this episode, this video. So episode number 3 is, I don't even know what video I'm in, but okay, so this video is going to be about breast augmentation. So what is breast augmentation? What is that? It's a boob job. So yes, I did get one. So this was part of my mommy makeover, which was breast augmentation and a tummy tuck. So I'm just gonna go over this part. My surgeon, like I said before, is Dr. Taneja from Pasadena, California, and he did my augmentation. So when I first started looking into the mommy makeover, one of the things is just getting a lift with addition of a implant if I wanted one, and then with the tummy tuck. When I first started to do my research, I was only gonna get a lift, but the problem with the lift, problem for me, not everybody, the problem with the lift is that it would have left me a little bit flat on this area. I guess it would have given me a more natural look versus a more round look, and I didn't want that. What I wanted was something more round, like if I'm wearing a push-up bra type of thing. But don't get me wrong, if that's what you want to do, you just want to lift, do a little bit more natural look, then you do you. So one of the beautiful things about this world, one of the beautiful things about life, is that we as humans, and I say humans because it goes for men and women, or and however you identify yourself, us as humans, we get to decide what we want and what we like, how we want to look, what we want to look like, whatever works for us. So me talking about my surgeries is not promoting it. I'm not trying to convince anyone to do it. I'm not telling anybody that you have to do it or this is the only way to get the look that you want to get. Not at all. Us as humans, we get to decide what we like and do it or not do it. It's up to you. I just want to talk about my experience of how it went and how to kind of research certain things, because there's things that you don't even know that you have to ask because you didn't even know it existed, or things that you didn't even know it was a possibility because nobody talked about it. So how are you even gonna ask? Like when you get lipo, you get itchy. How was I supposed to ask? Am I gonna get itchy if I get liposuction? No, you just figure it out as you go, and you're like, wait, you get itchy? Yes, your skin gets itchy. So that's why I'm doing my videos. So there's things that people don't even know that they have to ask, things that you end up finding out on your own. But these are just little tricks. I'm not forcing anybody. I am not forcing anybody that watches this to get plastic surgery or cosmetic surgery, however you want to call it. Like I am not, I mean, if you want to get it, great. I will embrace that. But if you don't want to get it, I will embrace that as well. If you want the way that we look, because I know there's a lot of people that say we need to love the way that we look. We need to love the way that we ended up after having children. We need to love what we've got. We should not change it, alter it. I'm for it if that works for you, but it didn't work for me. I didn't like it. So in order for me to get to where I wanted to get, I did need to get plastic surgery or cosmetic surgery to get rid of things that I cannot get rid of naturally, like excess skin, like saggy boobs. You can't get rid of saggy boobs, okay? Somebody once said that whenever they take off their bra, their boobs are so low that they touch the ground to check the temperature of the floor. Literally, like that was my case too. My boobs are like, ooh, it's cold. It's hot. Anyways, so back to breast augmentation. So every body, like human body, is different. So in my case, I didn't have a lot of breast tissue. I had a lot of skin. So by just doing the lift, it was only gonna leave me with smaller looking breasts. And it's not that I wanted something huge. I just wanted something that was more full, especially in the top area. So that's why I opted into getting an implant. So when you get implants, at least in my case, my doctor, he offers two kinds, which is either the saline implant or the silicone implant. So the major difference, he does have videos on his Instagram where he kind of goes over the difference between silicone and saline. The main things that stood out to me was with saline, literally just bags with saline water, and the silicone, they're made out of silicone. The reason I opted into getting saline implants is because in the event that it does rupture or leaks any of the implants, it only leaks out saline water. So your body, it just ends up absorbing it and peeing it out. And of course, you do need to go to get surgery to remove the ruptured bags. But it's so rare for that to happen. It's extremely rare, but that is one of the things. With silicone, if one were to rupture, the silicone would get into your breast tissue. And you do have to get in treatment for that because your body is not going to be accepting the silicone going into the breast tissue. So there is more complications with that. And also another reason why I decided to go with saline implants was because it's an implant that you don't have to get checked by a doctor if you're feeling okay. So by getting a saline implant, you just have to make sure and take care of it yourself, of course. Check yourself, like, to make sure that they're not leaking. And I guess the only way you're really gonna know if they are leaking is if one starts looking smaller than the other. If you do feel some discomfort, if you're feeling some sort of way, maybe some pain in that area, you know, that is an indication that something's going on. So yes, go to a doctor, get it checked by a doctor. But if you're feeling okay, they feel okay, they both feel the same size, you don't have any discomfort, then you're pretty much okay. I guess one of the myths from before, back in the day when people would get implants, you have to get them removed every 5 to 10 years, depending what implant you get. Well, nowadays, the ones that they make now, you actually do not, at least not with the saline ones. With the saline one, as long as you feel good, as long as you're not having any complications, any discomfort, no leakage or popping, you can pretty much just keep them for the rest of your life. With silicone, on the other hand, you do need to get them checked. Of course, you check them yourself, make sure that you're not having any discomfort or pains. But you do need to get them checked by your doctor I believe every 5 to 10 years. And they do recommend switching them out. Around, just like I said, do your own research on the surgeon that you use, because each surgeon uses different products. So you do want to specifically ask, how often do I need to change my breast implants? How often do I need to get them checked by a doctor, or just would I be able to check them myself? And those kinds of things, okay? So with the difference between the saline implant also and with the silicone, with the saline, it does give you a more round look, like if you're wearing a push-up bra, basically. With the silicone one, it's more of a teardrop look and more natural feeling. I did want a rounder look. That's why I ended up getting saline ones. Once you go to your initial appointment, they do give you a bra with the size, kind of like what you're looking for. You kind of want to show him like, hey, this is what I want to look like. And then he's going to say, okay, this is what I recommend and the amount of fluid we're going to put in. They're called cc's. So he'll say, I recommend, I don't know, X amount of cc's in your implant. And then he'll have you try it on to see what it would look like and if you feel good or not and all that kind of stuff. But with saline, in the event that you get them done and it's saline implants, and then later on down the line you're like, you know what, I want them to be bigger, or you know what, these are too big, I want them to be smaller, you can do that without going in to do another surgery and switching them out. With saline, it does have a little valve that they're able to, don't quote me on this, I don't know if the incision's on the side or in the bottom, I don't know exactly where the incision is at, but they do a small incision where the valve is at, and they'll take out the little valve and add more or take out some of the saline and then stitch it back up and you're good to go that same day. It's more of a clinical visit, so you're in and out. Versus if you were to get a silicone, you do have to get it's a whole new process, a whole new surgery for them to take it out and put in another one. With a lift, now for the incision, when you get a lift, there is your incision is a T, an upside down T. So it goes down the bottom across, not like side to side, it's maybe like the size of a finger, and then up to your areola. Your areola does get reduced in case they are bigger than what you want them to be. So with the lift, so the incision is down, going side to side, and then going right up, and then in a circle because they reduce your areola, and then they take off the excess skin to do the lift. So if you're just going to do the lift, those are the lift or the implant. With the lift, that's the incision you'll be left with. If you're just going to do implants but you don't need no lift, you just wanted to implants, your incision is just from side to side, nothing going up or none of that. So mine personally is from side to side. It's an upside down T. Obviously I can't show you what it looks like because my video will get flagged and I can't really show you the before and after, but just for reference, and I'm not exaggerating, whenever I wouldn't wear a bra, they were hanging down here and they weren't looking up here, they were looking down, they were looking sad. It was not it. So right now I am not wearing, I'm just wearing this top, I'm not wearing anything underneath, and they sit up looking happy, looking at the world, saying hello world, not saying hello to the floor. They're saying hello world, how are you? Oh, how are you? So yeah, so I got for myself 500 cc's overfilled for 550 cc's. So whenever you hear those two numbers, like how many, if you were to ask how many cc's did he get, and they say, oh, they give you two numbers, that just means that the implant itself is one size, and when it's overfilled, it's because it's gonna give more of a rounder, fuller look. It ended up being like around a size D in cup size, close to a double D. It's a very comfortable size. So at least with my doctor, he will recommend, you can tell him this is what I want, but he's gonna say, you know what, because of your frame, because of where your ribs are at, your structure, because every human has a different structure, where your shoulders are at, your ribs are at, this is how much I recommend. And then from there, you can be like, I want more or I want less. But just stick to what he says. As far as recovery, so for myself, this is a recovery for myself. I did have those incisions with stitches. I didn't have a drain coming out from this area only because I did have it with my tummy tuck. But if you only get your implants done, you will have a drain. And the drain is like this little valve that collects all your fluid. And you have to dispose of it yourself. But in my case, I didn't have one because I had it for my tummy tuck. And I'll go more into detail about the valve that they give you and disposing of your fluids when I talk about my tummy tuck. Do know that at the beginning, you will feel pressure on your chest. That is totally normal. It almost feels like if somebody's sitting on you. After a few weeks, you start feeling like you're itchy all around. But I think that's just your skin kind of getting used to that something's underneath it, and that your skin did kind of stretch out a little. So you do feel itchy. Do not itch. Do not scratch. Do not rub it. Do not rub the sides because sometimes you just want to rub it. Just kind of scratch it. Don't do that. Oh, don't do that. Another thing that you will not be able to do is sleep on your stomach. So if you're a stomach sleeper, you're not going to be able to do that. You have to sleep on your back. Actually, you can't even sleep on your side. You do have to give it at least 6 weeks before you're able to sleep on your side. Your surgeon, what they recommend as far as sleeping on your side or sleeping on your stomach. But it will feel extremely weird to be sleeping even on your side after getting it done. At the beginning, I would add like a rolled up small blanket or a towel, just to kind of like add a little bit of pressure so it doesn't feel like it's all going down like one direction, if that makes any sense. Like when you're sleeping on your side, I would add something to kind of add a little bit of pressure. But yeah, that was only for a few weeks. It wasn't like forever. Another thing, you do have to wear the recovery sports bra that they give you. Do ask which ones they recommend for you to get, but I usually just stuck to my one that I got from them. After I got my surgery, they sent me home with one, and it comes with little openings in the front. Another thing that you will notice after getting your surgery is you will not be able to lift your arms. You will not be able to lift it more than that. So you do feel pain in this area. They tell you don't lift up. So for your recovery, I highly recommend having buttoned up t-shirts or PJ shirts. Nothing that goes over your head because you're not going to be able to put your arms through it. You do want to have your button-up shirts for sure. You can even wear, well, actually any button-up shirt, and loose. You do want to be loose. You don't want to have anything tight other than the bra that they give you. But yeah, you're not going to be able to lift your arms like more than that. And then what else? Trying to think. What else? For this, I will not be able to show you the before, only the after. Because what am I going to show you? Like saggy boobs? There were saggy boobs. I breastfed 4 babies. They were sagging. They were sad, not saggy. They were sad. Bye.